How does previous exposure to xenobiotics affect future toxic responses in animals? Prior exposure to chemicals can lead to enzyme induction or depletion of detoxifying reserves, altering future susceptibility. For instance, a dog previously treated with phenobarbital may show enhanced metabolism of warfarin or diazepam due to induced CYP enzymes. On the other hand, repeated exposure to toxins like acetaminophen can deplete glutathione stores, making subsequent doses far more toxic. Such memory effects in metabolism underline the importance of exposure history in assessing toxic risk. How do multiple stressors interact to affect chemical toxicity? Stress, physical, nutritional, environmental, alters hormone levels, immune function, and liver metabolism, thus modifying how toxins are handled. For example, starvation reduces GSH and conjugating enzyme activity, potentiating acetaminophen or organophosphate toxicity. Transport stress in copper-loaded sheep can trigger hepatic release and cause fatal hemolysis. In poultry, heat stress can exacerbate aflatoxin B1 hepatotoxicity due to suppressed immunity and increased intestinal absorption. Such interactions illustrate the complex synergism between stress and toxins. What are common examples of toxicant-toxicant interactions involving enzyme competition? When two chemicals are metabolized by the same CYP, they can compete, altering each other's toxicity. Shyamulin and monensin. Competition at CYP3A leads to monensin buildup cardiotoxicity in pigs. Macrolides, for example, erythromycin, co-administered with theophylline or cyclosporine can increase their toxicity via CYP3A inhibition. Ketoconazole plus ivermectin in collies causes neurotoxicity due to combined PGP and CYP inhibition. These interactions must be anticipated in multi-drug regimens, especially in breed species with known metabolic constraints. How does the route of entry modify the expression of toxic effects in aquatic versus terrestrial animals? Aquatic animals absorb xenobiotics through gills and skin, bypassing first-pass metabolism, making them extremely sensitive. For instance, pyrethrins are nearly non-toxic orally to mammals, LD 1500 mg/kg, but highly toxic to fish like trout, LC 5gl. Organophosphates in water can affect fish and amphibians due to high gill absorption and limited detox enzyme activity. This highlights the need for root and species-specific risk assessment in ecotoxicology. Why are lipophilic toxins like PCBs and dioxins more dangerous during lactation? Lipophilic toxins are stored in fat and mobilized during lactation into milk. For example, PCBs and dioxins are transferred to nursing offspring in goats and cows, leading to thyroid dysfunction, immune suppression, and reproductive issues. Offspring may receive more exposure via milk than they would in utero, for example, with PCB 153 in goat kids. In pigs, zearalenone and Greek letter alpha zearalenol in milk cause estrogenic syndromes in female piglets. Thus, lactation represents a critical window of exposure, especially for lipophilic, persistent compounds. How does pCAR influence the renal excretion of toxicants across species? The pCAR compound in the urine pH determine ionization state. Weak acids, for example, acetaminophen, NSAIDs, are better absorbed in acidic urine, carnivores. Weak bases, for example, caffeine, strychnine, are absorbed in alkaline urine, herbivores. Ionized compounds are not reabsorbed and thus eliminated more rapidly. This affects dosing and antidote strategies like urinary acidification or alkalinization to enhance excretion. What is the role of polymorphic genes like ABCB1 in species and breed-specific drug responses? ABCB1, MDR1, encodes P-glycoprotein, which protects the brain and other organs by pumping out xenobiotics. Mutations in herding breeds, for example, collies, Aussies, lead to ivermectin sensitivity, neurotoxicity even at standard doses, increased toxicity with loperamide, vincristine, or butorphanol, variability in antineoplastic drug side effects, for example, doxorubicin. Testing for ABCB1 mutations is essential before administering high-risk drugs in these breeds. How do herbicides like paraquat demonstrate redox cycling and ROS generation? Paraquat accepts electrons and reacts with oxygen to generate superoxide radicals, causing oxidative stress. Damages lungs, pulmonary fibrosis, kidneys, and liver. Enhanced by selenium or GSH deficiency. Selenium supplementation in chicks reduces paraquat-induced lethality. This mechanism underscores the importance of antioxidant reserves in mitigating damage from redox-active toxicants. What makes phenylbutazone and sulfonamides dangerous in animals on warfarin therapy? Both phenylbutazone and sulfonamides displace warfarin from albumin, raising its free fraction and bioavailability, which can increase risk of spontaneous bleeding, prolong prothrombin time, lead to hemorrhagic shock in sensitive dogs. Thus, close monitoring of coagulation parameters is essential during concurrent use. What general principle can be drawn from this chapter regarding chemical toxicity in veterinary species? Toxicity is not merely a property of the chemical but a product of the interaction between the xenobiotic and the biological system. Factors include species, breed, and age, genetics, enzyme expression, and detox pathways, environmental, nutritional, and physiological status, route and frequency of exposure, co-administered drugs, and past exposures. The essence of veterinary toxicology lies in understanding these variables to predict, prevent, and manage adverse outcomes in animals.